Hey guys, Dr. Cool here, and I'm doing a short video series for you on the different types of lab tests that we run in our clinic for our functional medicine coaching clients. So, look, if you follow any of my work online, you may see that we work with people who have chronic health conditions like hypothyroid, diabetes, autoimmune conditions, hormone imbalances, and weight loss inability, and digestive health problems too. And one of the things that we do when we first take on a new client is to do advanced lab testing to uncover the hidden or the root causes for why that person has the symptoms that they do. And when we customize our programs, this information is very valuable in steering the ship in the right direction for what we have to do diet-wise, detox, supplement, lifestyle changes, cleaning out our homes, and everything that we include in our programs that we make customizable based upon the person's symptoms and the lab test. And so we run a variety of what are called advanced lab tests, and for each one of these, we're going to go through them one at a time and help you understand exactly what these tests mean to your health and what these markers mean for your symptoms too. And so that's actually a really good point to begin with, because a lot of the clients that I work with, if they have had lab testing done by their doctor, oftentimes they don't even have copies of it, or they have to go request copies of it, and their doctor has not sat down and adequately included them in this whole process and showed them what these markers mean to their health and informed them about how they're going to be taking the actions to address these either. So, we're going to help you understand exactly what each one of these markers mean to your health and how we interpret lab tests differently too. If you look on the screen here right now, you'll probably see some reds and some yellows, and so we look at lab tests a little bit different than most doctors do, and it helps give us more information as to why you may have symptoms despite being told by your medical doctor that your lab tests are normal. And so that's one of the first things we're going to discuss, is how we analyze your test differently. And then also, we run a lot more lab tests than most doctors do as well. Before the 1970s, doctors used to often run a full panel called a functional blood chemistry panel. They would do a lot more testing before the 70s, before insurance companies started regulating which tests the doctor could and could not run. And so today, unfortunately, we see a lot of just short panels or little snapshots into just a few markers in regards to what symptoms a person may be experiencing. So I always use thyroid, for example. If you've had your thyroid tested, if you have hypothyroid symptoms, oftentimes you may have had TSH or T4 done, but little other markers done in regards to your thyroid to make sense of the whole big picture. And so TSH and T4, that's enough to tell you if you have a thyroid problem, but it's not nearly enough to tell you where in your body that thyroid problem lies. And so if we just scroll down here for a minute, we run on a new client. There's many tests we can run, but at a bare minimum, if there's one test that I pick, it's a blood test called our functional blood chemistry panel. And what it is 2 pages worth of lab test that you see here that gives me all the important markers and all the information that I need to kind of get a snapshot into exactly what's going on with this person's body and in regards to their health at the time that this test was run. And so you see here, this is an anonymous test. This is actually a patient of ours. I changed some of the markers around and took the name out for just for confidentiality reasons for this test today, just to use as an example for if you work with us in our clinic here and we decide to go forward and do some testing, and if we take you on as a client, this is the type of test that you can expect that we'll run for your case as well. And this is the type of detailed explanation that you're going to get when we sit down to review your test too. So before we look at these markers, I want to help you understand how we look at tests differently. And so it's important to understand, if you've had lab testing done and you've been given a copy of your test, you're going to see that for each marker that's run, whether it's glucose, thyroid, iron markers, kidney markers, liver markers, whatever test is run, they're going to give you what's called a reference range and your result. And if your result falls within that normal reference range, everything's fine and your doctor's happy. If your result falls outside of this normal reference range, either low or high, unfortunately, a lot of the people that we see coming in through our doors, they're put on a medication that is supposed to get you back in the normal range, but it goes with a whole myriad of side effects, and it unfortunately just covers up your symptoms. It does not address the underlying root cause of why your test may be outside of what's called normal in the first place. And so where we're going to start is that what is considered normal is not the exact reference range that we would consider healthy for a person to be within. Meaning, follow me here. For all those markers we just talked about, whether thyroid, diabetes and glucose markers, hemoglobin A1c, iron markers, red, white blood cells, you name it, what's considered normal changes all across the country. So from New York to LA and everywhere in between, what's considered normal is going to change. Not dramatically, but the reason that it changes is because what's considered normal is the average for the given population that goes to that lab or the labs in that area. So state by state, county by county, they'll take people in a certain geographic radius around that lab, and what they'll do is they'll take all the markers, they will average out the numbers per each individual test run, and they'll say, okay, here's average, so this must be normal for the given population. Now, we should ask ourselves a couple questions there. If what's considered normal is the average for the given population that goes to that lab, we should ask ourselves what type of people are generally going to get their blood work tested. The answer is sick people. So generally, if you're going to get your blood work tested, usually you have some type of symptoms or some type of condition, even a diagnosed disease, that you're having monitored by your doctor. So if this normal or this average reference range is considered normal for a sick population, we don't want to really compare our health against this broad area considered normal for a sick population. The other issue with this type of analysis is that there's no magic set point where health ends and disease begins. Like if you're right inside the line here, everything's fine, and then the minute you cross over, now all of a sudden there's a problem. No, a better way to look at this would be that the further we get away from this center area, the further we get away from what's called the median part of the test, the center part of this test, that's where symptoms can begin to set in. And I have a lot of patients that come in here and they have real symptoms. They have literally no energy, or they can't sleep well at night, or they're gaining weight but they're eating like a bird, and they've tried different diets and they can't lose a pound, or they have brain fog setting, they can't think clearly anymore, their hair is getting thin, their nails are getting brittle, skin's getting dry, especially thyroid type symptoms here. And they go to their doctor, and the doctor says, you know what, your tests come back and everything looks normal. We'll go home and we'll test you again in 3 or 6 months. And what they're really doing is just waiting for the test to get worse and worse and worse until you would cross over into one of these red areas here. But there is a better way of analyzing your lab test, and it's called to look at the functional lab ranges instead of the conventional lab ranges. And so if we click down here, the difference between the functional labs and these conventional lab ranges is that instead of calling this whole broad area normal, when we look at a person's lab test, we want to see that your blood tests fall within that center median zone. So it's a much narrower, tighter way of looking at what's actually healthy for a person's blood markers that are tested. And so when we get a person's blood work back, we put it into our software, and we want to see that everything falls within this tighter range of optimal health or normal functioning. If a lab marker gets outside of this range, it will enter into these yellow areas. And your doctor may consider these normal, but we don't. This is the beginning of dysfunction. We call it functionally high or functionally low. And in these yellow zones, you might not officially be in the red, meaning you're not officially able to be diagnosed with a condition yet, but these yellow zones are where symptoms and dysfunction begin to set in. And so it's important to look at this for each one of our lab tests done. And if I go down and I scroll back here to our blood work test again, you're going to see that when we run blood work on a person, there's the functional range on the left hand, there's the conventional range on the right hand. We want all of these blood markers to fall within the functional range. And if it does, like you see here with this top glucose marker here, it's not highlighted. It's what we want it to be. We don't want to see any highlights. If a person's marker is outside of the functional range, using this hemoglobin A1c for example, if it's outside of the functional range, but still within your doctor's conventional range, it's going to be yellow. It's going to be in this area right up here again, where the beginnings of dysfunction are starting, and you're not officially in the red yet. You're not officially diagnosed with a pathogenic condition yet, but it's the beginnings of dysfunction as you leave that optimal functioning zone. And then finally here in the red, if we see that a test is outside of both the functional range and the conventional range, that's going to be highlighted as red. And this is something that even your doctor would consider a test that's high or low or just out of the normal range now. So, knowing that, let's go through this test here and go over each one of these markers one at a time. The first two that we run on the top here are, insulin resistance markers, diabetes or pre-diabetes test. And glucose, that's a common one a diabetic will have done. Your glucose can be high or low any given day. Meaning that if we look at it one day, it might be 93, the next day it might be 85, the next day it might be 100. It can fluctuate, give or take, what a person's eaten in the past 24 hours, even though this is a fasting test. A test that doesn't lie and that can really help to make sense of a person's insulin resistance or pre-diabetic risk or even diabetes level of, the level of their condition. It's called a Hemoglobin A1c test. And what this is a marker of the 3-month average of what your blood sugar levels have been doing. And so for a functional range, we want this to be between 4.1 and 5.5. Anything above 5.5 up to 6 is considered pre-diabetes. So this marker here, we see, we give a little indication of what this test could mean or indicate. So if it's 5.6, it could be insulin resistance or pre-diabetes. And then anything 6 or above is considered type 2 diabetes. If we come down here to the cholesterol markers, cholesterol, triglyceride, LDL, HDL, all of these markers that are so important to your thyroid function, to blood sugar and fat burning metabolism, to your brain function, hormone production. And these are very important markers to look at because every hormone in your body needs cholesterol to be made. And your brain primarily runs off of cholesterol and it loves to use triglycerides too. So triglycerides are a measure of the healthy fat in your bloodstream here. If we see that they're elevated, like in this patient's case here, these are almost always going to be elevated in the presence of insulin resistance or hypothyroid conditions. And so this is also a risk for a pending heart disease episode, a heart attack, or a stroke, or even atherosclerosis too. And so by putting this into the functional range, we can see that the cholesterol, the triglycerides, and the LDL are all in the red. The HDL might be considered normal by a lot of doctors because it's above 40. But we like it to be above 55, meaning this is still functionally low. So a lot of imbalances in this person's cholesterol markers here. If you see this in your own test, almost all the time it's going to indicate an insulin resistance, meaning the beginnings of diabetes or full-blown diabetes, or it's going to indicate a hypothyroid type condition. Oftentimes it's both. The next marker down here is C-reactive protein. This is probably the best marker for inflammation, cellular inflammation, to run inside your body. So we look at C-reactive protein. We don't want it to be above 1. Your doctor doesn't want it to be above 3. 5 is definitely elevated here, indicating inflammation of the cells of your body. If you want more information on what cellular inflammation means and how this is at the underlying root cause of every chronic disease out there, watch my video on cellular inflammation. I'm going to scroll down here because we run a few different inflammation markers. C-reactive protein is one of them. If I come to the next page down here, homocysteine is another one. So this person has their homocysteine marker elevated, so that's 2 of them. And then we also run uric acid as well. And I don't think I have it on this paper. It might be another one. No, I do have it. Didn't run this on this patient, but ESR, which is called erythrocyte sedimentation rate, that's another inflammation marker that you can run. So we thoroughly evaluate and analyze inflammation markers like ESR, uric acid, homocysteine, and again, C-reactive protein. If you're going to your doctor, you haven't had these tests run, they're so important to determine if your body's inflamed and if that's the root cause of why you're dysfunctioning, why you have symptoms of dysfunction too. We check people for anemia. So I can't tell you how many patients come through with low energy, and it's very important to look at iron, total iron binding capacity, excuse me, ferritin, which is a measure of stored iron in your liver, and also saturated iron too. And so if these levels here start getting low, it can indicate a person who has iron deficiency anemia, and that can be a major cause for why you have low energy. And it's very important to look at if there's any problems in regards to the red blood cells. So we look at things, there's a whole red blood cell panel here that goes from your hemoglobin and hematocrit levels, the amount of hemoglobin and oxygen in a blood cell sample, or the red blood cells themselves here. And if these things will begin getting low, that's either going to indicate anemia from an iron deficiency or anemia from a B12, nearly in all type cases. We'll look at platelets to evaluate clotting factors, red blood cells. You see that this one's here is high. If it's low, that's more concerning. It's going to almost always indicate anemia like we talked about. If red blood cells are high, it's almost always going to indicate a probable dehydration. So not drinking enough water or not absorbing our water. Oh, coming a bit down here again, skipping pages. All right. So we talked about red blood cells. This is important because your red blood cells carry the oxygen to all your tissues in your body, and so it's important to look at that along with iron to make sure that we're getting the full picture. Down here, your white blood cells begin, and this is not part of your red blood cell oxygen carrying component of your cardiovascular system. Your white blood cells have to deal with your immune system. And so there is a total white blood cell count that we see right here. And then there's 5 individual types of white blood cells that make up this total white blood cell count. And so if we start here at the total count, if we see that this is elevated, it's usually going to indicate an ongoing or an acute infection within the body. An elevation of white blood cells, always think acute infection. If they were chronically low, if they were low, below 5, or in this case, to be in the red, below 3.7, it's going to be a chronic infection in the body. Something even like cancer or lymphoma that's lowering down your immune system over years and years or months and months. If we see that the total white blood cell count is out of balance, either high or low, then it's important to be able to look at these next 5 individual markers, because all 5 of these make up this total count. And each one of these markers performs specific roles in your body that, if they're high or low, can give us some indication as what might be going on there. So neutrophils, for example, we see that they're elevated in this person's case. Neutrophils deal with fighting bacteria or fungal infections in your body, or in the presence of inflammation too. And so if we see here that it's actually almost in the red, 1% higher, that would be in the red there. If we see neutrophils are elevated, there's probably an ongoing inflammatory or bacterial infection in this person's body. Most often when I see these, if we would do a gut test, we're going to find that there's an overgrowth of pathogenic bacteria in the gut, or candida in the gut too, or possibly a person who gets like frequent urinary tract infections, yeast infections. All of those can be triggers for neutrophil increase. If we see lymphocytes are increased, that would be more of a viral infection. Now, lymphocytes and neutrophils, they always have an inverse relationship to each other. So if one is high, the other one's going to go low. Lymphocytes fight viruses. And so being that neutrophils are high, I suspect that there's a bacterial infection, most likely in their gut. Because lymphocytes are low, they're probably low because neutrophils have went high. Remember, I said they have an inverse relationship to each other. So the body's focusing more of its efforts to fighting a bacteria infection. Is not overly concerned about a virus right now. But if this was flip-flopped and your lymphocytes were high, that would be a viral infection. Monocytes, these are the parts of your white blood cells, or these are the white blood cells that deal with cleaning up tissue breakdown and tissue debris. So if a liver was breaking down, or if your gut or certain tissues were degenerating and breaking down, you would begin to see monocytes begin to be elevated there. And then finally, eosinophils and basophils, these are kind of white blood cells that deal with allergic reactions, so food allergies or bee stings or some type of an allergic response in the body, parasites even, you would see these things begin to be elevated. If we come down here and look at the thyroid markers next, this is one of my favorite parts of the panel, because a lot of people that I work with have thyroid conditions. A lot of women that I work with are frustrated with the current intervention, the current treatment that the doctor has them on, and they really just haven't been given enough information to make sense of why their problem, why they have the symptoms that they do in the first place. And so if you're watching this and you do have hypothyroidism, make sure that you go to reversehypothyroid.com, and you can watch an entire webinar that I've done on hypothyroid and the 3 main causes of hypothyroid 2. I'm going to briefly cover some of these lab markers here, but it will make a lot more sense if you go and watch that video first. And depending on when you're watching this video, I may have already uploaded that webinar onto drzachcole.com too, which is the main website you're probably viewing this one on. All right, so TSH. TSH is a marker from your brain to your thyroid. TSH is telling your brain, or TSH is made by your brain to your thyroid, and it's your brain's way of telling your thyroid to make more hormone. So what happens is your brain has 2 glands in it, your hypothalamus and your pituitary, and they work together to determine if you have enough thyroid hormone in your body. And if you don't, then your brain will send the signal to your thyroid to start making more hormone. That's what TSH stands for, thyroid stimulating hormone. And your brain is giving your thyroid gland, which is in the front of your throat, the signal to stimulate and begin producing more hormone. What happens is, if TSH is high, and in a lot of my clients that's the case, that is a marker to indicate hypothyroid. Because think about it, if your thyroid is low and not functioning well, your brain is going to kind of turn up the thermostat. It's going to increase the volume. It's going to increase the signal to your thyroid to make more hormones. So the higher the TSH, the less functioning your thyroid gland is. And that can be from, it can be primary hypothyroidism, meaning it's just not functioning on its own, or it can be secondary due to something like Hashimoto's disease, which we'll talk about in a few markers here. What your thyroid does is then your thyroid makes mostly T4. Almost all the thyroid hormone that comes out of your thyroid gland is made in the form of T4, and that should be between 6 and 12 for the functional range. You see here at 5.3, to us, this is going to be low. Your doctor may consider this normal, but this is the beginnings of dysfunction for your thyroid gland. What happens next is 90% of T4 is made by the thyroid, but it must be converted into T3. T3 is the active version of the thyroid hormone that gives you a good metabolism, good digestion, good hair, skin, nails, energy, all the benefits that come from thyroid that we attribute to having good thyroid hormone balance. All of that comes from T3. But what happens is we said your thyroid mostly makes T4, meaning for this conversion of T4 into T3 is very important to test to make sure that's happening. And T4 is converted to T3 in your gut, in your liver, and in your kidneys mostly. So if we see here that T4 is not getting converted to T3, and we do see that, 1 point lower, your T3 would be in the red here. So just not enough T4 getting converted into T3. That's going to be liver, gut, or kidney issues as well, because those peripheral organ systems are not healthy and are not making that conversion of T4 into T3. The next marker to look at is T3 uptake, and this is a measure of if the cells of your body are able to utilize that T3. So the thyroid makes T4, T4 gets converted to T3 in your gut, liver, and kidneys. Now T3 has to be used by your cells, and so T3 uptake is a measure of if that's happening here. Free thyroxine index, free T3, free T4, these are all measures of, without getting too complicated, your total T4 and total T3, when they circulate in your bloodstream, they are bound to what's called a protein carrier, meaning imagine that they are inside of a taxi cab, traveling and floating through your bloodstream. To be used by your cells, they have to get outside of the taxi cab. That's what these free markers are here. Free T3, free T4, they are much smaller percentages of your overall hormone, but they are the percent that's available and ready to be used right now by your cells. They have gotten out of the taxi cab. They are no longer bound to that protein hormone. So I hope that makes sense without getting super complicated and without having visuals on the screen here, but very important to run. And in this person's case, you can see that both free T4 and free T3, the percent of thyroid hormone that's available and ready to use by her cells, are really low. Down here, we can see that some other markers here that are really important for thyroid, TPO and TGA. These are both autoimmune markers. If you have thyroid disorders, I cannot stress to you how important it is to have these markers run, because these are autoimmune markers. If these are elevated, and in this person's case they are not, if these are elevated, it means that your thyroid is not dysfunctioning on its own. It means your thyroid is being attacked by your immune system. And that will always be more of a gut issue because 90% of your immune system is located in your gut. If a person's autoimmune, simply taking more T4 replacement hormone like Synthroid or levothyroxine will do little to nothing to affect a person's symptoms, to improve a person's symptoms. It will make your blood work look better, which will make your doctor happy, but it'll do very little to affect how you feel. Finally, the last two you see here, iodine, selenium. These are two important vitamin markers that your thyroid needs to function correctly. Iodine is something that you can do through a urine test, so it's actually not part of this blood panel here, but we include it because often we'll send a person out for a urine analysis along with their blood work. All right, one more page to go. Coming down to page 2 here, if we see at the top, the first three here, AST, ALT, GGT, these are all liver enzyme markers. If these would be elevated, it would indicate a person whose liver tissue is destroyed and breaking down. So as the liver breaks down, it will release these enzymes into the bloodstream in an elevated state where we can test and look at that. We don't want to see it above 26. Look at these. Sometimes your doctor will consider as high as 70 or 45 normal. Absolutely not normal. This might be, if it's this elevated, it might be a fatty liver case, fatty liver disease, or like end-stage liver dysfunction. But if it's anything over 26, that is a liver that is toxic and dysfunctioning. We already said homocysteine is one of the inflammation markers that we run. LDH, this is found in it stands for lactate dehydrogenase. Both LDH and alkaline phosphatase can be enzymes that are found in the liver, but they're also found in a lot of other tissues in the body too. If they're elevated, it's just going to indicate, liver disease or tissue inflammation and breakdown. Bilirubin, this is a byproduct of your red blood cells being broken down in your spleen. And so if it's high, it can indicate advanced blood cell breakdown. If it's low, it can indicate anemia. And you have to look at some of these markers in conjunction with each other. So we would also want to have the iron markers like we already talked about, or the B12 if we're suspecting anemia. Total protein, this can be a marker if it's low for malabsorption or leaky gut issues or malnutrition if a person's just not eating a good enough diet. And then things like albumin and globulin can be immune system components too, very important to look at in people who have thyroid and autoimmune disease. If we come down here a little bit further, sodium, potassium, and chloride, these are all electrolyte markers, very important for fluids moving in and out of the cells of your body, very important for nerve conduction, for heart functioning and heart muscle contraction. And a lot of these, actually all of these, are under the control of your adrenal glands. Your adrenal glands, yes, they secrete a ton of hormones, but they are two endocrine glands that sit on top of your kidneys that help to regulate water balance in your body and electrolyte balance. And so if these things get elevated, yes, if sodium's elevated, that person may just be dehydrated. But if we see a couple of these are elevated together, almost always we're going to be suspecting adrenal gland dysfunction. Most of the patients that I work with have hypoadrenal gland dysfunction, meaning they are adrenal gland fatigued. CO2, carbon dioxide, this has to deal, it's a marker that deals with metabolic alkalinity or acidity in the body. Your body should be slightly alkaline. If we see that this is below 25, it indicates a person who's entering into the realms of possible metabolic acidity. And when your metabolism is acidic, when your internal environment of your body is acidic, disease thrives in an acidic environment, especially cancer. Dr. Otto Warburg won the Nobel Prize in the 1930s for demonstrating that cancer cells, first of all, they use sugar. They have 8 times more receptors for sugar than our healthy cells do in our body, but they thrive in an acidic, anaerobic environment, meaning no oxygen. Your healthy cells need alkalinity and lots of oxygen. So very important factors when considering how to improve our symptoms and get healthier. Wrapping up here, blood urea nitrogen and creatinine and the ratio between the two. And this one at the bottom here called glomerular filtration rate. All of these markers are kidney elevation markers, and we are mostly concerned if they are high, as you see in this picture here. So if blood urea nitrogen or creatinine is elevated, these are two markers that are supposed to be cleared from your bloodstream by your kidneys. Your kidneys filter your blood every single minute of your life. They're supposed to be filtering out impurities or metabolic byproducts that have built up in your bloodstream. And if they're not, if these things start getting elevated, excuse me, it can indicate sluggish kidney function or the beginnings of renal, which means kidneys, renal dysfunction. So that's not good. And if we look down here at the GFR, I'm not going to scroll down because a pop-up keeps coming up on my screen there. GFR means the filtration rate of your kidneys. And so this should be about 59. I like it to be closer to 100 actually. If it's below that, it really indicates the beginnings of kidney dysfunction, even stage 1 kidney disease too, which can only be diagnosed by your medical doctor. All right, finally we have some vitamins here: calcium, magnesium, phosphorus, vitamin D. Vitamin D, they're all important to your cell functioning and physiology, but especially vitamin D is needed to make every hormone in your body. We're finding out more and more vitamin D is an immune system component. It's almost being reclassified from a vitamin into an immune system component and a hormone precursor. So important for gut function, so important to fight the flu, the cold, cancers. I mean, if your body's deficient in vitamin D, like you see I wrote here, numerous pathological conditions can stem from that. It's so important. So if you are low, I typically have patients take 10,000 IUs per day and get plenty of sunshine to get back into a normal range again. And then finally, you see some of these other tests here at the bottom. Leptin is a measure of your hormones for burning fat, so we want to see that our body is leptin sensitive. Uric acid and ESR, we already covered those, 2 inflammation markers. And then finally, the B12, if there's anemia issues that we suspect by looking at a person's red blood cells and hematocrit and hemoglobin levels, if it's not iron, it will often be B12. And there's specific patterns that can show up that can lead us to believe if it's one or the other. So Hey, look, I hope this really helps you understand our blood test. This might have went a little longer than I was expecting it to, but if there's one test that I can run for a person that will give me most of the information that I need in order to make the correct decisions for how we're going to get this person well again and address these underlying root causes of their symptoms, it is this test here, Functional Blood Chemistry Panel. It is important to note, and I do have to just note this just for just for the world we live in today, that we do not use this test to diagnose, cure, or treat any diseases. We simply use this test to see where some dysfunctions in your body may lie, and then how can we support your body through nutrition, through detox, through some of the lifestyle changing efforts that we do in our programs. This test is not used to diagnose or treat a person. Only your medical doctor can do that. And I also don't recommend any person ever making changes to their medication without talking to the medical doctor too, simply by having a test like this run. So now that I've said my little disclaimer there, if you have any interest in contacting our office, if you would like some help and you would like to have these tests run here, call our office at 724-237-5299, or there's a button for a consultation on this on my website here as well, www.drzachcool.com. The first step would be to set up a consultation to evaluate your health issues right now, if it's something that we think we can help you with, and if we can, we could talk about the next steps moving forward with some testing too. So, hey, visit my website, look for some of these other videos following up in this email series, and you can watch some additional videos on the testing that we do too. So thanks for your time. Have a great day.